We have today Stacey Rodriguez. She is 40 years old, been a patient for 6 years, and has been on testosterone replacement therapy for a little over a year and a half. And what Stacey has done is put her story on paper, and she'll read it to us. You're on.
Okay, my name is Stacey Rodriguez. Over 1 year ago, I walked into Dr. Gordon's office, and he asked me what brings me here today. I said to him, either there is something medically wrong with me, or I am losing my mind. I'm not sure if I should be here, or I should be seen by a psychologist. He asked me why I felt this way, and I began saying how I felt. I stated that I felt miserable, I was always tired, and very emotional. As I stated this, I began to cry uncontrollably. He handed me a box of tissues and said to me that I appear to have the classic symptoms of someone who may be lacking a significant amount of testosterone. Thought to myself, testosterone. Okay. He began to explain to me what was testosterone, and he started asking me a series of questions. Some of the questions he asked, aside from being tired and having mood swings, was about my sexual activity, which was another problem I was having, but of course they didn't want to discuss that because I felt embarrassed. I wasn't having as much sexual relationships with my partner because of a lubrication issue. He began explaining how testosterone worked and how it's used and how it's produced in our body, and with a simple test we can determine my level of testosterone, and that if he was wrong about his assumption about me lacking testosterone, that he would gladly refer me to a psychologist. I agreed to have my blood drawn, and within a few days the results were in. I called him, and he said that I was like a woman who was 80 years old. I had no testosterone, I was not producing any, no wonder why I feel the way I felt. So today, I receive a shot of testosterone every 3 weeks. I feel amazing, I have energy, my moods are better, I can deal with stress without being overwhelmed, and my sexual activity has increased. I myself am very amazed of how quickly I begin feeling results. Since the shots, I have had some hair growth, which is a common side effect, but in comparison to how I feel, that is very minor to me. I have experienced some acne as well, but as we played with my dosage level, we are able to, the acne has been subsided. I no longer have acne. We started at dosage of 60 cc's, and now we're on 25 cc's, which is working great. The hair has subsided, the acne has gone away, and I still feel wonderful. I feel like a new person. Feeling depressed and miserable is no way to live. If a shot of testosterone is what I need every week for every few weeks, then so be it. It has given me my life back. I'm proud to have a shot every week without any complaints.
Okay, very nice, very nice. I hope that story will bring about the day when every woman is getting the testosterone she needs, and every man. Just of course that it wasn't 60 cc's, it was 60 milligrams that we started with, and then 25. Now I start women on 25, and really hair growth is an almost non-existent factor anymore. But everybody feels good. So thank you very much. I appreciate it very much.
You're very welcome.
We're in the home of Mr. Pat Boland, who is a 57-year-old gentleman and has been on testosterone replacement for a little over a year and a half. And why was it that you first came to me about your testosterone?
My wife first presented the idea of testosterone replacement to me by speaking with a doctor and also having gone on testosterone replacement therapy herself.
And she had a positive effect?
She had positive effects, yes.
And what was it that was bothering you that made you even think about replacing your testosterone?
There was about a 75% libido loss in me, and I couldn't deny it.
Was that getting worse?
It seemed to be gradually and progressively getting worse.
Getting worse. Not something you were happy with?
Not something I was very pleased with, no.
At that time, had you noticed that there was any change in your energy, any change in your strength, physical strength, any change in your mood, anything like that? Had anything like that happened?
I had been diagnosed with depression in 2003, and I noticed that yeah, life itself was becoming more chore-full. It seemed like everything was a chore, and yeah.
Okay, so you came to me and you went and had a blood test done, and the blood test showed that you indeed were deficient in testosterone,
Yes.
and very few men your age would not be deficient. And we started you on testosterone replacement. So tell us what happened.
Almost immediately there was an increase in libido, and the sexual effect of it was pretty dramatic and also really nice, but nothing extraordinary, nothing that was
Nothing
out
excessive?
of bounds, no. But I also noticed over time an increase in my ability, in my capacity to just do the choreful type things of life, like tying up garbage. I've always been somewhat of an athletic guy. I like to run, I like to do push-ups, and I noticed an ability to do those better, to run better, and to feel better afterwards also.
So you, despite the fact that you really hadn't been aware of any loss of the physical ability, when you replaced the testosterone, there was a resurgence, made you really realize that you had lost something.
Right. I was easily able to recognize that I was more athletic, I felt more muscular, and I felt this increased capacity, as I say, to just do things.
Did your libido return to what you would consider to be a satisfactory level?
Yes, absolutely.
Okay. Now what about the psychological changes? What about the depression?
The depression, I noticed myself, just in retrospect, that the depression that I had been diagnosed with was probably getting a little bit worse. I haven't been on meds in quite some time, since 2004, but I noticed that the depression was getting a little worse and a little very gradual. After testosterone therapy, I also noticed that my sense of self-esteem increased, and I've always been sort of a can-do kind of a guy, and I noticed that just my ability to be able to do things with more vigor helped me with that. And I find no needs for any antidepressants.
So the depression has lessened?
Yes, absolutely.
Significantly?
Significantly.
Okay, and I guess we could sum it up by saying that the testosterone replacement has just made you an all-around happier guy.
Oh yeah.
That's the best word for testosterone. That makes you happy.
Yeah, testosterone equals oh yeah.
Okay, thank you very much.
Thank you, doctor.
That was